works in hardcore tech, and now you are doing a lot of work in healthcare. The NHS has, I see your work, and I congratulate, but I don't think we've talked deeply about it. Some of your works are being integrated into NHS, and so many good feedbacks with mental health, some of the works that you've done. So some people might think, and that's why when we reach out, your work in the healthcare sector is very important that we talk about, that the applications of tech in healthcare, and how can someone get into that space? What are the things that you need to be aware of? You need just to be a core person, or is it during your work experience that you pick those things, or how would you tell someone to approach it? Because NHS is the biggest employer in the UK, if not the whole of Europe. There are a lot of roles there. So how does your work being a tech person, then intersecting into healthcare, how can someone be in that space?
I think the main background is that I'm one of those people that, my dad wanted you to be a doctor, but have a hard head, unfortunately. That's one thing I didn't inherit from him. So I've always had that passion for healthcare. And when you talk about tech, a lot of people don't know that it's a very wild space. Think about it. The way we receive healthcare in, let's say, 1960 and today in 2024, what has really changed? It's pretty much the same thing. You're sick, you go to the doctor wastes your time half the time, and then you get medication. That's just literally it. So healthcare hasn't really penetrated that industry, partly because of regulation, partly because there's focus in other areas. But I think what I would say is it's a huge territory because there's so many things you can do. Like me personally, in the past maybe decade, I've gone from working in things like Sworky, which is a circuit training application that people just look at their phone and it tells them what exercise to do, and they do. And now that has like 30, 40 million downloads, right? I didn't build Sworky, I just helped build it, so it doesn't belong to me. And then pivoting into more mental health, which is, again, a completely, nearly untouched area. And you start to realize, like, something as simple as just being able to book your appointment today, like it's still difficult. Like we can book Ubers, we can do so many things, but like we have like Babylon and that's it. So you start to realize that there's so much opportunity, there's so much you can do, and you can also apply your passion in so many different ways. So it could come from the mental health angle, it could come from just developing tech solutions to manage people, or to even just keep track, something just tracking, because a lot of what healthcare is tracking. Healthcare and education go hand in hand. It's impossible to build for healthcare without building for education. Even your medication, if you look at the back, it's just take this, because I'm dealing with that right now. So, right. So you can always sort of like find your way around that on so many levels, and I guess apply yourself. And yeah, there's so many industries that you can touch on.
Wow. Thank you so much. So he mentioned something very important. You can't build for healthcare and not build for education. And that analogy of there's always an education behind it, that the knowledge that you need to know about the medication, how you should take it, and all of that. So SK, people know about being a microbiologist in Nigeria and being a microbiologist here in the UK. It's two different worlds entirely, because we know the challenges we have in having practical experience back home.
We get a lot of people in Nigeria. For example, you get students go for 3 months internship program in Nigeria when they go for Southwest, and in the first 2-3 weeks they're already drawing bloods, and they start calling themselves microbiologists, biochemists, and all of that. So when they come to the UK, I think the difference is the safety and the quality aspect of things. So the way we do things in Nigeria is completely different from the way we do things here. Here we are very, very, very particular about safety. We're very, very particular about the quality of work that we do. There are agencies that are behind you, watching over your shoulders, watching over you as an individual, watching over the organization that you're working for. We have the UCAS that is in charge of the accreditation service. And we have the IBMS and the ACPC that looks after you as a professional. So for everything you're doing, there's something that is like protecting you. There's something that you're protecting as well. So you're trying to, as much as possible, to do everything the way it's meant to be done. Now, when you're coming from Nigeria, the experience you have in Nigeria is not lost. The only thing is you will have to get a UK experience. Getting UK experience, a lot of the panelists have talked about how volunteering and how you put yourself out there can be a stepping stone for you. It is very, very important that we do these things because, trust me, it's not impossible, but that UK experience, if it's lacking in your work, it's going to be visible at your workplace. So if you have two persons that just started work today, one is strictly from Nigeria and one graduated from UK here and has UK experience, you can tell there's a little bit of difference in the way they do certain things. And with biomedical sciences, quality is what we're looking after. And if that quality is not there, unfortunately, you might struggle.
Wow, thank you so much for that deep breakdown. And I think we will come to the qualifications needed in a bit. Dr. Peko, you mentor a lot of people that want to get into the medical space as a GP or probably practice here to start with. And there's this thing about Plug 1, Plug 2, which is famous with medical professionals. And what would you tell someone? Is that still the only way to practice here, or there are other things that we can do? Maybe coming from a microbiology background or coming from another background that is not medicine. What other things are there from your experience that you've been seeing?
Yeah, thanks for that question. So my name is Dr. Douglas Yalapepo, and that question is quite important because myself, I have background in biomedical sciences before going to medical school. So I studied human anatomy from the University of Port Harcourt, and I went to medical school at the University of Calabar before coming to the UK to do masters in reproductive medicine, science and ethics in the University of Kent in Canterbury. So obviously, when I was in biomedical sciences, which is preclinical, people who were already in medicine, so I wanted to be a doctor, so I had to go through the back door to come into medical school. So I think that kind of gave me an edge to be a different kind of doctor. And in terms of moving, I don't know if there's any medical doctor here, but if you are, and there are different pathways to come to the UK to practice, you don't necessarily need to be to come through the PLAB 1 or PLAB 2 route, which is the common one that gives you a General Medical Council license to practice in the UK as a fully qualified doctor. So some people can come in through alternative pathways. You can do membership exams in Royal Colleges. Depends on what college you want to go into, specialist training, you want to go into general surgery, internal medicine and all of that. So you can do membership exams of those colleges and get your GMC registration to practice in the UK as a doctor. You can also, like SK has mentioned, come through biomedical sciences, where you can go through a graduate entry program to study medicine in the UK, which is doesn't make sense, to be honest, because it's quite expensive. And why do you want to spend 5 years paying that huge tuition when you can pay a fraction of that in Africa or in Russia or one of these other countries to become a doctor, and you still end up practicing and doing the same thing with someone who has spent thousands of pounds here just to become a doctor. So so there are alternative routes to come into practice, but most importantly, because I just don't want to talk about doctors, because I'm not sure there are lots of doctors here, and also doctors, I mean, our pathway seems to be a bit very protected, like you know what to do, you don't really look for the jobs come for you and all of that. But other people who are in the healthcare sector, who also want to maybe practice in the hospitals or do something, work for the NHS, there are lots of opportunities out there. I mean, you can go through the ranks. I mean, I know a lot of people do like support work or care work and all of that. You can transition to any aspect of healthcare you want to. Like the other day I was talking on space, I know some lady who is also a member of our community who got a job as a support worker in the hospital, but to work under like a department and she's been doing that and became so very good. And the nursing assistant, the nursing officer gave her the pathway to go through becoming a nurse. So that means you can transition from one level to another level of healthcare. I know some lady who's an influencer on Instagram. She did a nursing program, and afterwards she became a midwife, and now she's in medical school. She's just in her penultimate year to become a doctor. So there are different aspects, routes you can take. It depends on what your end goal is. But at the end of the day, whatever you want, if you go for it, you will always get it.
Wow. Thank you so much for that breakdown. Uki is back because there are a lot of people that you've been mentoring in terms of project management, and there are a lot of project managers going into the NHS and the kind of work they do. So, from your training and from the mentorship that you do with people that are getting into that industry, does core medical knowledge apply? Do you need to have some deep knowledge? If you say you're a project manager and you want to work in the NHS, give us some pointers. What do you need to do?
Really good question. Yes and no. Right.
Okay.
I'll explain why. It's good to okay, let me demystify something. Quite a number of people don't believe you can have, we call them administrative jobs within the NHS. And administrative jobs doesn't necessarily mean support or administration work. Administration in the NHS is centered around supporting the core system, right? Core system within the NHS. That is supporting the doctors, supporting policies, and so forth. So there are roles within the NHS, i.e. project management, business intelligence, data analysts, that a lot of people overlook or don't even know exist within the NHS. So going back to your question with regards to, do you need medical knowledge? No, you need to focus. No, the first answer when I say yes or no. No, because if you do your job really, really well, let's say project management, for example, and you understand the fundamentals of project management and you understand how you can support the ecosystem, then you're good. Yes, because it gives you an added advantage to understand the terminologies that are used, right? So, yeah, not really, but it really helps if you do know some medical terminologies and how to have conversations if needed, especially if you're supporting any sort of like project. Let me give you an example. So like I was involved in working around the introduction of BP home devices, right? So I need to understand why we needed to deploy all these BP home devices, because we have to communicate, because there's a bit of change management as well. We have to communicate the need of utilizing these BP home devices at home as opposed to going to the hospital, to the GP, reducing the GP hours, right? So you do need to understand how the medical system works, especially if you want to be taken seriously as a project manager or as a business intelligence, especially around patient outcomes. You know, if I was to mention patient outcomes to anyone in any other industry, they might not really understand the impact of the work that they're doing across the nation. Yeah.
Wow. Thank you so much for that breakdown. And like I said, all our panelists have left the door open for us. If we let them know that you came to this event and you want to reach out to them, they will find some small time to support us. And I just want to thank them so much for doing this. And in the last round of questions, before they kick us out of the hall, I got a 1 hour extension so that they could let us be. And I just want to thank you for you doing so much within a very short time. SK, I'm a microbiologist. I want to work in the UK. What qualifications in very, very short, what qualifications should I target? And apart, we talk about reaching out to people, regional consult, what qualifications should I tap on? Should I jump into?
Okay. So with to work as a biomedical scientist in the UK, you definitely need to do your degree assessment.
Okay.
So there's IBMS, Institute of Biomedical Scientists. You need to do your degree assessment with them. So basically what they're doing is they're checking your degree, what you had from Nigeria, they're checking the equivalent of it in the UK,
Okay.
and they're looking for what is missing in your degree.
Same like ECTIS that we have in
Yeah.
construction. Okay.
So when they check it, they'll probably tell you to do 1 or 2 modules, and these modules you can do them online or just go to any university and do them. And after that, you would definitely need the practical experience. So they work hand in hand. 50% the theory, which is your degree, and 50% the practical. The practical, what you do with the practical is you can get them by completing a registration portfolio, which is also accredited by IBMS. However, if you're registered in Nigeria with the Medical Lab Science Council of Nigeria, you can do the international registration, which basically means that your registration in Nigeria, you apply to ACPC saying that you're qualified in Nigeria, and straight away they will take you on. I just have to pay some fees. And yeah, that's it. But definitely, because I've been like comparing to the other panels where you just have to do some training programs with biomedical sciences, you need a degree.
You have to go to
Yes.
Yes. Thank you so much.
Yeah, thank you.
Sani, you are an advocate of deep work. You are an advocate of someone being as good as they can be, whatever they've chosen to be. And there is this challenge that we have with the younger ones in terms of, and I think we older ones have it as well, like not knowing how far you have to go. You know, how long do you have to iterations, as you guys call it, like how long do you have to stay in that field? How long do you have to? We're talking about deep, horizontal, and that time. So your work has not started today. You've been at it for a long time. Everybody see Sani say, Sani is he does this, he does that, but some people do not know what goes on behind the doors. So if a young person is looking at this panel now, because the visuals will be out, so many people will see. If a young person is looking and think, okay, I'm in high school, I'm just starting first year, what would you tell that person as briefly as you can? Like, look, it is possible, but you need to do this, and this.
Yeah, so you're right, it's crazy because I was having this similar conversation with a random gentleman. So I think a lot of people listening may not know what Toyyib is talking about. So I generally believe in what I call it the I developer, right? Which means when you're starting off, your goal should be become an expert in whatever it is you're learning and get as deep as possible in that particular thing. Now I know a lot of people want to be like a jack of all trades. If you look at my first website, it goes, I am the jack of all trades. Like, hire me, right? Forget jack, I am the guy of all trades. That was what I wrote. And the idea is, when the higher you go in a particular area, the more noticeable you are and the rarer you get, right? It's a pyramid. The higher you go in a pyramid, there's less blocks, right? Which means the opportunities, the biggest opportunities are disproportionate for the people at the top, right? It's a Pareto distribution. And that means you're more recognized. So now, a lot of people don't want to do that because they want to pivot and do and just, look, direction is more important than pace. You can go somewhere, the wrong place very fast. Instead, just bide your time, have depth. The analogy I use is, it is much easier to jump from the top of one building to the top of another building. If there are 2 buildings, one of them is 6 floors, one of them is 7 floors. It's much easier. I can just push a ladder from the 5th floor to the 6th floor of another building. And when I'm going there, I can just jump into the 5th floor of that building. I'm not starting from ground 1 anymore. So it's much easier. Then you build multiple I's. It becomes a U and all these other numbers. So that's what I would tell that person. Find something you're good at, and you're gonna want to do a lot of things, but there'll always be 1 or 2 things that you want to spend energy. And that doesn't mean you don't figure out what crypto is or what Bitcoin is or go bet your house rent on crypto. You can do all of that. I'm not with you, but get really good at something and bide your time. When you wake up and say, what is this? You'll be like, you know what you're talking about. And then eventually, doors will start to open into other areas. That's just to round up, like, if you look at my journey, just maybe 8 years ago, people knew me as the Ionic guy, and then they knew me as the Angular guy, and now I mostly work with a lot of MongoDB and DevRel, and I'm already transitioning to something totally different, so it just works up that way, and it would actually happen.
Wow, thank you so much for that. Thank you so much. Dr. Pepo, you, apart from being a family GP, you are also a member of other professional organizations. Like, what I'm trying to get at is that you are not a person that limits, in terms of where you want to go. You are always looking at another mountain to climb from what you've done in your career. Would you say it gets easier at the top? Because some of us struggle wherever we are. We think, oh, this place is very, very high. Maybe when I get to the next stage, responsibilities will reduce. Or what happens at that stage? If you could touch on that briefly, please.
Yeah, I think it's easier at the top anyways, but so a bit of my journey, because when I finished my first degree, I come from a family where, it's like political. So my uncle was in the Senate, and his friends, like the politicians, and my mentor contested to become governor of our state. He won the election, but we rigged him out. But anyway, so I was working with him. So you can imagine the exposure. He had a leadership center that could decide. And so after my first degree, I was supposed to continue working with him, but I told him I want to go to medical school. And he was like, okay, that's fine. So when I finished medical school, and that was when he was contesting to become governor, and he asked me what I wanted, and I said I want to come do my master's in the UK, and he was like, okay, that's fine, I'll give you the money to go. So all those sort of exposure kind of widened my horizon and opened my mind to know that there should be more than just medicine. So, and when I started started training to become a family physician, and realized that all my friends are doctors, and we just talk about patients and treatment and all that, and it wasn't quite exciting. I wanted to know other people, and that was when I started thinking of business, and I joined the business community and started learning, formed my first business, started investing in small angel and all of that. And so one day I was having a chat with people, and people were talking about tech and all those things, and I had no idea what they were talking about. I was like, I don't want to be that doctor that all I know about is just how to treat cough and chest pain. I wanted something different, something more, so that I could fit in. That was how I learned how to do YouTube, started doing social media and all of that. So I think if you just broaden your horizon, that's what I keep saying. And that's even why I'm in GP, because we are doctors of so many specialties. So I get bored doing one thing over and over. I like to know other things. I like to know a bit of so many other things. Like being jack of all trades, doesn't matter. You can still be master of all, So so when you connect with people, who are successful or get to the top, if you read Max Gladwell's book, Outliers, you realize that when you get to the top, it's easier for people. I can give this guy a job to be my photographer because he's done for you. I trust him for the quality of work he's done for you. I will easily give him that to give someone who is just starting, even if that person is good. But because he's already at the top. But then again, being at the top means you need to keep honing your skills, because it's easier for you to feel like you've arrived and you fall off the ladder.
Wow. Thank you so much, Dr. Peko. So, Buki, this will be the parting shot of the whole program. I want to get into NHS. I've just had my degree or my master's degree. It's not related to project management, but I want to work in NHS as a project manager or an assistant project manager. If you could, in probably 2 short minutes, just tell us, what do I need to do?
Really simply, just go onto the website. There's a number of websites you can apply. There's Track Jobs. NHS.net, which is there used to be NHS Digital as well. There's for the project management space, there are a number, you can even check out Indeed, just go online. There are a number of jobs that's available within the NHS. It's so funny because A couple of months ago, I started tweeting jobs from the NHS, and I was thinking to myself, why do I have to do this? Like, you know, people can easily just find these websites and just type in projects. Even in the search functionality, you can specify what your skill set is, you know. One advice I would give is never sell yourself short, because I see a lot of people doing that with your degree and your previous experiences, and that's why it's very important that you need to understand what skill sets you have. Do that skill set analysis, and then also, if you can, before I go, it's important for you to do like a career roadmap. Remember when I was sharing earlier on my story about how I pivoted God knows how many times, and I decided that doing project management was the thing for me, because what happened was that I fell into it accidentally. I came in from a band 6 in the NHS. If anyone knows what a band 6 is, so it starts from band 1, 2, 3. So I band in from a band 6. Oh, I know it's quite. I didn't realise it was quite big, but within 6 months I was promoted to a band 7, and that's because within 6 months, I realised that the work I was doing was pretty much, you know, work that I have been doing for the past 10, 15 years. So, and that was when I started taking my career seriously, and I created a career roadmap, and I gave myself 10 years. I said, within 10 years, I want to get to the very top. I'm in year 8, 7, 8, and I don't want to expose my band, but very top of band 8. So, which I'm really, really grateful for. So what I would say is be intentional, check on the website, go onto NHS. That's how I found my job, nhs.net, and that was without me having any project management experience. I didn't even have any project management certification. I just took my degrees with me. Literally just took my degrees with me, and I applied for the job. They had 2 roles, one was fixed and one was permanent. I got the fixed term role, and within 6 months, I had been promoted above the one that got permanent role.
Wow.
So, in saying that, I just want to encourage each and every single one of you, the information's out there, as opposed to like 20, 30 years ago when we didn't have like internet, and everything we needed to get was from the website, not from the library, right? So, right now, the world is your oyster, the information's out there. You don't need people to, you do need people, but you don't need to go out and pay extra when the information's there. If you need hand-holding, it's different. Right? But the information's there. Google is your best friend. Yes, there's a lot of information on there, but learn to understand what is it that you are actually looking for. The majority of us don't know what we're looking for, and we're just applying, and that's why a career roadmap is really the best way for you to understand, okay, I'm on this career pathway. In year 1, I want to achieve this. In year 2, I want to achieve this, and so forth, and stay on that journey, and you'll be successful.
Wow, wow. Thank you so much, everyone. Ladies and gentlemen, our last panelists, thank you so much.